Snap Diagnostics. Rest and test at home. Snap Diagnostics makes at-home sleep testing simple and effective. Test registration is required to limit your out-of-pocket financial responsibility. If you did not register already at your doctor's office, please call the Snap Diagnostics registration line before proceeding. The SNAP test is a sleep study. It monitors your breathing and/or snoring sounds, as well as your pulse and blood oxygen level while you sleep. For optimal results, it is recommended that you perform the test 2 nights in a row. This data is analyzed to assist your physician in the diagnosis and treatment of breathing disorders. It is a very simple process and takes place in the comfort of your own home. The SNAP diagnostic system comes complete in its own carrying case. The system features a cannula and microphone to record snoring and breathing sounds, a respiratory effort belt, a pulse oximetry finger sensor, the recorder with power cord, and instructions. Your doctor's office should have plugged in all of the sensors for you. Make sure they are all securely attached. If the sensors are not attached, refer to the instructions for assistance. It is important that you keep your normal bedtime routine to get the most accurate results. The room should be quiet and comfortable, and you should allow yourself the time to get a full night's sleep. Set the recorder on a bedside table. Plug the power cord into a wall outlet and switch the power on. The respiratory effort belt should be placed around the lower rib cage with the sensor located over the sternum. Adjust it so that it is tight but still comfortable. Place the cannula on your face so that the longer set of tubes points down toward your mouth. The band should pass above your ears. Make sure the cannula is properly fitted. It should be snug but comfortable. Test the sensor by speaking your name a few times while looking at the display on the recorder to confirm that sound is being detected. It is important to remove any fingernail paint, polish, or other substance on the nail for the finger sensor to work correctly. If you have acrylic nails, use your big toe instead. An adhesive pad holds the finger sensor in place. Notice that the holes match the shapes of the 2 raised areas on the sensor. Peel off the paper. Place the sensor onto the pad. Then place the sensor on your fingernail using the diagram to guide you. Fold the sensor over the end of your finger and then wrap the pad around. The wires should run down the underside of your finger. The recorder's display will let you know when the sensor is properly attached. This may take as long as 20 seconds from the time you put on the sensor. For pediatric patients, it is often easier to wait until they have fallen asleep before putting on the sensors. Place the cannula on the child's face as you would for an adult. The pulse oximeter, however, should be placed on the child's big toe with the wire running across the bottom of the foot. Wrap some tape around the foot and wire to hold the sensor in the correct position. Once you have all of the sensors in place, press the recording button. The LCD will indicate that recording has started and the amount of recording time available. If this is not the case, call your physician's office or Snap Diagnostics customer service line. If you need to get out of bed during the night, simply take off the sensors, while allowing the unit to continue recording. When returning to bed, put the sensors back on and verify that the lights on the recorder are green before going back to sleep. The simplicity of the Snap Diagnostics system makes troubleshooting easy. If the LCD displays this message, you need to adjust the oximeter sensor on your finger. First, try moving it around while it is still attached. Wait 20 seconds each time to see if the message goes away. If it does not, remove the sensor and make sure that the finger, fingernail, and sensor are clean. Reattach the sensor. Wait another 20 seconds and check the LCD again. If the message still remains, call the Snap Diagnostics customer service line for assistance. When you wake up the next morning, remove all of the sensors. They can be reused for the additional night recordings as previously instructed. Turn off the power, unplug the recorder from the wall, place everything back in the case, and return the unit to your physician's office as soon as possible. Snap Diagnostics combines home recording with sophisticated technology and fast reporting services. If you have any questions or comments, feel free to call or email us. Snap Diagnostics. Rest and test at home.